And Lucille and Patrice, we are going to get started when you are ready.
Okay, welcome everyone to our Resolutions Caucus. My name is Lucille Vitale, and I am a Vice President for New York State PTA, overseeing advocacy. In this caucus, the Resolutions Committee will review all the proposed retentions, updates, rescissions, and new resolutions. This year we have two. It's very, very exciting. Like our Kyle just mentioned, she said if you need to write any questions, if you have any questions throughout the night, please use the chat box. We will be monitoring it throughout the evening. We're very excited about that so we can get all of your questions. And now I would love to introduce our president who would like to say a few words, Dana Platon.
Hi, everybody, and thank you, Lucille. I love resolutions. I started my PTA quote unquote career on state as a resolutions coordinator. And so resolutions is deep in my heart. And looking around the Zoom room, I see many of you who feel the same way. I see Jane is here, and Jane taught me everything I knew about resolutions. So I'm happy to have shared some of my knowledge around the Zoom room to others. But I'm just really excited that the rest of you have also tuned in, because this is the heart of what we do. We are an advocacy association, and very important part of our convention in a week and a half will be to adopt new resolutions and retain some old resolutions and update some old resolutions. And I believe there are even some rescissions that we're going to be looking at. So I just want to thank all of you for joining us tonight. I want to thank Lucille, our DO for advocacy, and Patrice Racklin, who is the chair of the Resolutions Committee, who has done a phenomenal job. And you know what? I'm always excited when someone who follows me does a better job, because I think I did a pretty darn good job, which means, Patrice, you had knocked it out of the park. And I thank you. And I thank all the members of the committee as well. So I am going to turn it back to Lucille. I'm also going to go off camera because I'm going to be listening. I'm not going anywhere, but it's so much work to prepare for convention. So I'm going to try to multitask, and you don't need to see me doing that. So again, thank you to everybody here. Thank you, Lucille. Thank you, Patrice. And I'm going to turn it right back to the both of you.
Okay, thank you so much, Dana. I would now love to introduce our wonderful resolutions coordinator, and our team is also on camera. Wave team. Hi, resolutions team. There you are, resolutions committee. Patrice Racklin, and she'll be running the caucus tonight. So Patrice, it's all you. Oh, I think you're muted.
There we go. Hi, sorry about that. I do have a really great team. I'm the resolutions coordinator for New York State PTA. And I'm going to just put a shout out to the team because I'm nothing without them. They are literally the wings beneath my wing. They're the wings beneath me. They keep me up and we fly. So just give a wave, guys, when I call your name. It'll be in alphabetical order. Christina Arroyo, Mary Ann Carangelo, Candy Dukowski, Susan Fisher, Patricia Jenko, Amy Heisick, Elena Rulo, Tina Scheck, Megan Zarki, and Lissa Zukoff. Of course, our designated officer you've met, Lucille, and our esteemed executive director, who, if we have any questions, we can always go to her, Kyle Macaulay Belakopitsky. That's a team that really has worked to look at the 2014 resolutions. We look at our resolutions, which are in Where We Stand, every 7 years. And we do one of three or four things with them. We can retain them, we can update them, we can rescind them, we can recommend and refer and do all kinds of stuff like that. But really it comes down to having things ready for you at convention. The purpose of this caucus is to answer any of your questions regarding any of the resolutions. And for just a brief overview, In case you don't know, I don't know how many super experienced people, but I always assume everybody has a question. So retentions very simply are a previously adopted resolution, which when we go to convention, they're 7 years old. And that whole resolve, you either take it, retain it, or you get rid of it. So you're voting yay or nay on that. And it cannot be amended. It's just, yeah, we like it, we're going to keep it, or nope, we don't want it. And it's gone. Updates are something that's been previously adopted, and the wording of the original resolve or resolves has been changed. And you will see that as we move forward. You got info when you looked under convention, under the resolutions packet, and into the information in that. And things were bolded and italicized and stricken for your convenience. Any new wording that we've put in, I've put in red, so it's immediately discernible. When we rescind something, those rescissions, and we're recommending them to be, we have 3, recommending those to be rescinded. Those are kind of, they've exceeded their time. They are no longer relevant, or some law or what we were asking for has occurred, and they're not needed at all now. So we will get rid of them. So that kind of gives you an idea. The new, obviously, are new resolutions that were sent up to state before April 1st. And we looked at them, we vetted them, and we're bringing them to the floor. And you'll see those and be able to vote on those at convention at the end of the month. So we're kind of really excited about the fact that we have 5 retentions, 11 updates, 3 rescissions, and 2 brand new resolutions. I have Amy's going to help me with our presentation so that you can see words. I really would love you to, if you have a question about anything in specific, just feel free. Pop it in the chat. We'll be monitoring the chat, and we can answer those questions. Most of these are word changes when it comes to the updates, or word additions. And but if there's something that you see in particular that you have a question about, please let us know. Otherwise, we'll be going through them pretty quickly. Amy, can we share?
Hang on, it was open and now I'm having slow computer issues. So give me 2
It's
seconds.
okay. We're patient. We love technology. I'm just glad we can all be here. Sure beats doing it during convention. Everybody gets a better look at it this way. Thanks so much, Amy. Appreciate it. All right, so there you go. I've
Right, we can see
introduced
it, right?
everybody. Yeah,
Okay.
we're good. Thank
Okay.
you. All right, we can go to the next slide. Just says,
Yep.
yeah, that should say 2021, but whatever. And, and we've got the retentions. These we're going to either keep the way they are or they're gone. So anybody have any questions on retention 1? I don't see anything in the chat.
Nope, we're good.
Okay, moving right along. Let's go to 2. Any questions on soil contamination on school grounds? Questions? Concerns?
Just as a reminder, we're not going to be able to see you raise your hand. So if you could just, if you have a question, just type that right in the chat. I have a question, or your question right in the chat.
Okay, we're good with 2. Let's move on to 3.
Yes, Jessica, we're going to be posting this on our convention page.
A lot of these are pretty self-explanatory. All right, no, nothing on 3. What about 4? That's reasonable access to food during school. All right, hearing nothing. What about retention 5? Because that'll wrap up the retentions. This discharging of firearms within school areas. Okay. All right, so now we're just going to move on to the updates. So remember, anything that's new is red, and anything that's been stricken, it has a strike through it, we're proposing that that language be removed. Okay. All right, we're going to move on to update 1. Remember, any kind of comment, concern, please let us know. You have a question, don't be afraid, just pop it in the chat. You can see here we've added a few words, predominantly families. We've really looked to be very inclusive. So you'll see that a lot in our updates. Okay, seems we're quiet on update number 1. We're good?
Looks like we're good, Patrice.
Okay, we can move along. Social host laws, we have an update for number 2, social host law. And this has been updated to support legislative changes. Any questions?
Let's wait a bit on this one, Patrice, because there's some,
Sure.
there's more new language than others.
Yeah, this one does have a little bit more language than others.
I'm not seeing any questions on this one either, Patrice. I think we're good.
Perfect. All right, now we're moving along to update number 3, drug testing in school districts. Does anyone have any questions about the added language? As you can see, we took the word abuse in the 3rd resolve and in the 2nd resolve and changed it to use. It's the language is substance use. Substance abuse is not used anymore. So that's part of the change.
I think you're good, Patrice.
Okey doke. Thank you, Kyle. Moving along to update number 4, education for HIPAA right to privacy and healthcare proxy. Here we basically spelled out what HIPAA stands for and added guardians to be more inclusive. Does anyone have any questions, concerns?
Patrice, could you explain why that last resolve was struck?
Sure. We used to, years ago, usually put in resolution to be forwarded to National PTA for consideration. So we no longer do that. There's no need to do that. If there's something that we feel needs to be pushed forward, we will automatically do that. So if we see a gap in their advocacy, that's something we always are looking for, which we will take steps to correct that and push up any kind of resolutions that will fill that gap or deal with something perhaps that is a subject that is not does not have any advocacy standing on. So that's no longer needed. We'll do it automatically. Annie?
I'm seeing no comments. I think you're good.
Okay. Okay, great. Now we're moving to update number 5. That's 504 committees. And this was a few words were ended and/or guardian in particular to reflect the inclusive language that we are trying to get into all of our resolves. Any questions?
I think you're good.
All right, moving on to update number 6, which is cellular phone towers. Right here, there was just a little rewording to make it flow a little better. And adding in again, local communities and families, which this has basically been updated for clarity and to again reflect that inclusive language that we are looking to strive for. Anyone have questions regarding cellular phone towers?
You are good.
Okay. Now we're looking at update 7, indoor air quality guidelines for schools. And we've updated this, to add in the words federal, state, and local, covering all our bases, especially in light of the pandemic. So we do want to make sure that everything's really, really clear and we're covering that. We have stricken the word highest and the word levels. So now it would read, if approved, promote the safest levels for indoor air quality in schools. Highest is a subjective term, so it's better to just be straightforward. Any questions at all on update number 7?
You appear to be good.
Okay. Update number 8 is protection of groundwater supplies. Okay, and as you can see, some of these resolutions have been around a long time. This one's from originally 86 and has been updated and retained for a very long time. We chose to update it this time around to add in the inclusive language of families and communities. Anything in the chat? No?
You appear to
Okay.
be good.
Here we are with update number 9, which is herbal cigarettes. Again, inclusive language. What has been stricken is just kind of been reworded so that it flows a little better. Other than that, we haven't really touched it. Any questions?
Looks like you're good.
Okay. Moving on to update 10. Now this originally was pupils with support service needs, which kind of was a little misleading because it's actually about support services for at-risk children and youth. So in addition to changing some of the language within the resolved themselves, we've retitled so that it is much clearer and more to the point. We've added in that we want school administrators to create and implement procedures and policies. And we don't want to lock ourselves into just what's required. That's why we've added in the words including but not limited to. That broadens the scope, which is always a good thing. Any questions on this?
Appears you are good.
Okay. So we're moving on to our last update, which is update 11, children and youth in poverty. Okay, so the was put in to make the sentence a little smoother. We've got again, such as including but not limited to, which gives more broad expanse and reach to the resolve, and added in instead of we've crossed out for quality parenting because we weren't sure exactly. That's subjective again. Who determines what quality parenting is? And beneficial actions, and we've been a little bit more precise, saying initiatives that support children and youth in poverty. That covers it better. Does anyone have any questions on update 11?
I think you're good.
Okay. All right. So now we're going to go to rescissions. And like I stated earlier, rescissions are resolutions which have kind of served their purpose. So here we have rescission number 1, which is the Committee on Preschool Special Education, CPSE parent member. We're recommending that this be rescinded. Education law has already provided for this. So we don't need it any longer. It's one of those things that we wanted it and it happened. Any questions on this?
Let's give this one a minute, Patrice, just so everyone can read through that statement.
Absolutely, yes. Yeah. I don't want anyone to think that we're not advocating for special ed. We certainly are. And we continue to. It's an important part of what we do.
I do think you're probably okay.
And moving on to rescission number 2. This is reinstate and restructure the Regents component retesting system. This was no longer needed. The bottom line is that there are new pathways to graduation, and the pathways have safety nets, and the Regents component testing system has become obsolete and is defunct. They don't use it anymore. So it doesn't pay to advocate for something that doesn't exist. So please read through the statement. You'll get a very good idea of what our rationale is. If you have any questions, please feel free to ask.
I think you may be okay, Patrice.
Okay. And to the last rescission, rescission number 3, adolescent pregnancy prevention. The committee is looking to rescind this because basically it's extremely outdated language and doesn't reflect the current needs of our children and youth. All right. But we were very mindful that when we decided to recommend this for rescission, we felt it was important to write a resolution that would cover some of what this wanted without being outdated. And we'll talk about that when we talk about new resolutions. Anyone have any questions? Feel free to ask.
Patrice, I think you may be okay.
Okay. All right. So now we're going to move to the new resolutions. What's different about the new resolutions is that you can make amendments to change any portion of that, where, you know, when we're talking about updates, you can only address and make an amendment on the language that we've either stricken or that we're adding. But you cannot touch the rest of the language in those resolutions. In the new resolution, everything's up for grabs. So if there's something within those resolutions you would like to see changed, you certainly can make an amendment for that. While I'm talking about amendments, I do want to mention that there is a deadline for amendments because we are hybrid. And that deadline will be November 12th at 5 p.m. That's this Friday at 5 p.m. All right, so if you do want to make an amendment, go on to our website and there's a space there. You'll see something that you can download a form, and then you can make your amendment and send it in. Okay. All right, so new resolutions. We've got new resolution number 1, and that's the protection of and support for transgender and gender non-conforming students. So I'll give you a minute or two to read this in case you haven't, and to formulate questions. This is what you're looking at, is the entire resolution. It's got the whereases and it's got the resolved. And the resolves are what we are looking to have happen. The whereases are the reasons that have brought us to the resolves. If you have any questions on this, because we will go to the next slide, has the narrative summary, so it'll give you a little bit of an idea what kind of support we have for this. I'll give you a minute or two to read that, and then some time to pop questions in the chat. All right, if anyone has any questions, wants clarification, has a concern, this is the time. Please give us an idea of what you're thinking. We're happy to help. We're happy to answer anything that you may question.
Teresa, I think we're okay on this.
All right. All right, moving right along to resolution number 2, which is the comprehensive sexuality health education. This is the resolution that was written to kind of fill in the gap from the hopefully the rescission of rescission number 3. So take a few moments and read this. The resolves is what we're looking for, and the whereases is why we wrote the resolves. This also has narrative behind it, a narrative summary to give you a little bit more info. Okay, let's take a peek at the narrative. And feel free to put your question in the chat. This is a safe environment. If you have any questions, concerns, we're here to answer whatever you need. Okay, so we have some questions in the chat. Hold on. Someone said, I have questions and concerns regarding what's included in the national learning standards and where do the national standards come from? So we'll have someone speak to that. Susan? You want to unmute?
I'm just looking it up in my research right now. The National Sexuality Education Standards were released in 2012. The standards promote healthy relationship building skills as one of the 7 fundamental components to a comprehensive sex education curriculum. I'm just trying to see, the question was, where do they come from? And they were all, there's the National Sexuality Education Standards. That's what they're called. I'm trying to see if I can find clearly where they come from without having to look it up on the computer. There was, I know there was a collaboration between educators, state and government and CDC, and they're published, I think, in the Journal of Academic Health or something like that. Just give me a moment to look it up now as I'm looking through the papers. Journal of School Health, not Academic Health, sorry. They were published in the Journal of School Health in 2012.
Somebody popped a link into the chat. See it?
That's not exactly the link, but that is guidelines that are based on these also. That was also just a different way of, a different format that they are shared in.
Okay. Does anybody have any other questions or concerns? Monty said that link that was popped in the chat by someone does not work.
I'll try to get a link that works.
Wonderful. I think what's important here to remember is that and would you go back to the actual resolution for me, Amy? I think that part of this is important. What we're asking for here is we're looking, we are supporting the creation and implementation of a comprehensive sexuality health education program. All right. That doesn't mean that we are going to make the program. That's not up to us to do. That's up to stakeholders, NICED, school administrators, parents, all concerned parties that would normally weigh in on any new curriculum, whether it's English, math, whatever, because that's kind of what I think people, I know I've heard something that perhaps we want to make it up ourselves. No, that's not what we're going for. The curriculum has to be made. So that's something that's very integral. 20, somebody else just wrote something else.
Yeah, and Patrice, I'll just add that, what will happen when something like this happens if law or regulation does get passed, then what will
Mhm.
happen is, as a part of that process, SED will call together a work group from all of the stakeholders, parents,
Correct.
educators, school board members, other kind of stakeholders involved in this work, medical professionals and teachers and principals and superintendents. They will put together a work group, and then the work group itself will work on regulation, and that will be the regulation adopted by SED. So this resolution just says we want that process to start, and we want some of the national standards that have been adopted elsewhere to inform some of that work. This doesn't say that we would adopt the national standards, but it says that it would, we want this process to work, and that SED should begin this process and having that conversation to develop something for New York, because we don't have anything uniform. I hope that
Correct.
helps, at least with the process.
Thank you. Yes, and that's very true. Thank you so much, Kyle. So basically, as you know, what Kyle just said, it's really to start the conversation and to get that ball rolling, because we really don't have we don't have a curriculum at all, which is kind of scary. What we have is from 1950 something, Susan, was some bizarre.
Yeah, ours comes from No Child Left Behind era, and New York State standards are mostly abstinence only until marriage, and the only standards are to address HIV prevention.
So that would be the only standard they're
with a
concerned
focus
with.
on abstinence as the primary
Way
method.
too. All right. So we're a little out of date in New York State. And that was really one of the reasons why this resolution was created.
Laura asked if she can come off mute to continue the conversation.
Well, how do we feel about that, guys? Yes.
Yes,
No?
so Jessica Hort, sorry. I'm just catching up on things. Yes, let me just scroll. So sorry. Da-da-da. Yes, Laura, if you want to unmute yourself, that's great. We can bring you on screen. Patrice, let's just stop the screen share for 1 second, and we'll bring Jessica on screen for
Absolutely.
questions.
Great.
Thanks, Jess.
Oh, now I can see everything.
Sure. Hi, everyone. I'm so sorry. I joined late, so I was not aware of the rules. And so I hope I'm not stepping out of line at all here. This is also my first time attending one of these. And
No,
so
we welcome
Glad
it.
to have you. Yeah, wonderful.
thank you so much. Yeah, I've just been paying attention to this one in particular, and I completely understand the intent, the positive intent behind the resolution, and the fact that updated curriculum is necessary. What gave me pause was when I looked at some of the details in the document that was shared on pages 20 and above. So, talking about new types of families and all that, that all makes sense. The things need to be updated. But there were certain other elements of there in terms of the types of things that they would be covering in grades K-2, in grades 3 to 5, that I just felt were not age appropriate or, necessary at those ages. And I don't want to go into, I feel like I'm stepping out of line already. So I don't want to go into too much here unless I'm allowed. But, in ages K-2, talking about defining child sexual abuse, in terms of, grade 6 to 8, it's talking about, and I hate to use these terms, it literally says it in the document, vaginal, oral, and anal sex. In grades 3 to 5, talking about things like masturbation, et cetera. I have a third grade son. And so I have concerns regarding some of that content. Overall, I understand the intent of a resolution, but I don't know the process in terms of if a bill gets passed, how much control we as parents have over the exact curriculum that goes through. And so I just wanted to learn more about that, understand more about that, and how seriously I should take the details that are in the document. And again, that's just a brief summary, some of the notes I shared with my own PTA as well. But there's a lot more detail in that document. Yeah. So anyway, that was, oh, and actually I didn't realize, sorry, my camera cover was over.
That's okay. There you are.
So
There you are. No,
Uh,
no, and I'm
okay.
glad that you bring
Yeah.
bring all that up, because when Kyle was explaining the process that we in New York State have regarding curriculum development and how that works, I'm sure all that's going to come to the floor. All right, that's going to be discussed. I think that the document was just to give an idea of what, what other states do. That doesn't mean we're going to do it. New York is a little bit of an anomaly. There are some things that we are so much better at. Our special ed laws are much better than a lot of other states. Gun control is better. There's all kinds of things that happen in New York State to protect our kids that is really thought out, and not everything, but most really thought out. And the process that has to ensue once they start looking at a curriculum like that, and that's really what we're asking them to do. Let's look at doing some kind of curriculum that is much more in tune with today, because what we have is certainly not. But once we get into that process, the stakeholders get involved, parents get involved, then I think that you could probably, they probably may put out surveys. Kyle could give you a little bit more idea of the how intense the process can be. I think that a lot of that's going to get addressed.
That's helpful.
know?
I appreciate the
Yeah, so I'll
time.
just chime in on what would typically, so if we have new law or that's passed, from that point, then a law is passed or SED does some type of regulation or guidance. To get to the local district point, that's kind of step 3. So if we have a law that's passed, then SED is in charge with implementing regulation to implement that law. As a part of that process, all of the stakeholders, PTA, we would have a seat on there. As I mentioned, our superintendents, our principals, we seek feedback from our members as we go through. New York never adopts somebody else's stuff. So New York is not going to adopt the other kind of national standards. We always do our own standards. We like doing that because we're New York and we're the best. So so we will adopt our own standards. Now, I want to make sure, even though when standards are adopted, I'm kind of my hand. So standards are here, and then curriculum is here. Curriculum is different. So curriculum is local. So your school district would look at the standards, and then your school district and your school board would adopt your local curriculum, and that's school-based. So we have a number of steps. So first step is a law is passed. Even if a law isn't passed, SED can still put out guidelines to school districts to do this type of work. Then the school district itself actually adopts your local curriculum based on what SED has put out as guidance. Does that make sense? So you as parents would have a number of points. So at the state level, we would have an impact on the legislation if it goes the legislation route. I'll be honest, if it's something like this will not go the legislation route. So it will typically go the SED route without legislation. So SED would probably put out some type of guidance document to say to school districts, really, you have to have some type of sex education. And I should say we do have, some sex education rules already, but this is a little bit more comprehensive. So every school district has some type of similar features. SED would put out a framework, as they call it, or a set of guidelines, and the school district itself would adopt its local curriculum to implement the framework and the guidelines. So it's kind of how the step works. So we would have input at the state level, at the SED level, and then you all as PTA leaders would have a great impact at your local school district level. And that's where most things actually happen for curriculum. Curriculum is always local. I hope that helps.
Very much. Thank you so much again. Apologies if I broke the process at all. I joined.
No, it's great, and great questions too.
I appreciate it.
Fantastic.
And
Thank
just
you.
a quick note, currently the New York State guidance is that parents can opt out, and that still is included in the proposed legislation that's in the education committee and everything. The parents are still able to opt out. So if at any point when you see what's being taught, you're uncomfortable and you don't want that you have the choice to opt out with no detriment to your child.
And much of the things that are covered in some of the other national documents are actually covered in our current health curriculum now anyways. This would just be making it a more formalized process. It's exciting. We got a question. Hoo-hoo.
I know. Yay. Anybody else have any other questions or concerns? Wow. Wow. All righty then.
And this is your last call on your questions for anything that we've covered so far. We'd be happy to go back, but last call on questions. And I will say, we do hope on behalf of Dana and our executive committee and governance team, we hope you join us at convention. Don't forget, registration closes on Friday, so don't delay, please.
It's always great to be part of the process, and that's, we're glad you're here. We're glad you're part of this process, and we hope you're going to be at the convention either in person or virtually. You do have until the 12th to register virtually, and I hope we do see you. All right, if there's no other questions, I just want to thank the resolutions team. They are fabulous. I also want to thank Lucille for her support, and Kyle for her support, and of course Dana, whose steps I follow. So I just really, this is always, this is my passion, resolutions and advocacy, and anybody can do this. So don't be shy. If you're here and you have an opportunity to step up to the plate to do some advocacy in your school district, in your town, in your county, in your state, go for it. Thank you so much for being with us.
Thank you, everybody. Thank you for attending. I hope all your questions were answered, and we hope to see you next week. Thank you, Resolutions Committee, and thank you so much, Patrice. Fantastic job.
See ya.